नमस्कार. आयच्या ह्या खाशेल्या कार्यावळीत तुमकां येवकार. आज आमचे अशेच दोन गेस्ट आसात. म्हाका दिसता जांचो अनुभव ह्या कोरोना व्हायरसाच्या सिच्युएशनांतलो आनी जांची एक्सपर्टीज म्हाका दिसता गोंयकाराक आनी ह्या देशाक खूब गरजेचे आहा. दे आर लिडींग अ ग्लोबल एफर्ट. तांचे हाजें नांव बरें आहा की endcoronavirus.org. They are leading, they are working with some of the leading scientists across the world to contain this outbreak. And त्यांचं primary objective असा so that we can get over with this very disastrous situation as soon as possible. ते म्हळ्यार Sriram Chandrasekaran has worked in corporate India and now he has dedicated all his energies towards containing this outbreak. He is working with top scientists of the world, and most importantly, they are getting all the data that is relevant and important for us. आणि एक दुसरी आसात आमचे गोंयकार राज कुंकळकार, जे तांचे बरोबर काम करतात, जे भारतात मॅजिस्ट्रेट लेवलाचेर डिस्ट्रिक्ट लेवलाचेर सध्या काम करतात. ज्या ज्या जाग्याचेर हे COVID-19 हॉटस्पॉट्स तयार जातात थंय. Raj is joining us from Goa right now, and Sriram is joining us from Netherlands, which is turning out to be another hot spot for COVID-19 in Europe and in the world. So welcome both of you. We are in the middle of this huge problem, and I think for everybody this is an unprecedented situation. Even administration wise, this is an completely unprecedented. You cannot very difficult to blame a chief minister or a prime minister where there is no user manual for this kind of a situation across the world. So how are you looking at it from the right now, from the present standpoint? What do we need to do to contain this? I think let's move on to other issues later, but to begin with, what do we need to do to contain this right now?
Yeah, thanks Pramod. So as a country, we need to first understand that our only option is containment. There are a lot of people who are talking about health or economy. This question is really not an option. If you have people who are sick, this can escalate so quickly that there is no way we can handle the costs. So on average, every person ends up infecting 3 to 5 people. And this is in other countries, not in India. And it's a metric called R0. Okay, that's the reproductive rate. In India, people live very closely together. So even with the lockdown, on average, we think people could infect 3 other people. Now 3 sounds like a small number, but if I infect 3 people and every person infects 3 other people, within 10 chains, we are now at an outbreak with 60,000 people. So that's very important for us to understand. Before you know it, exponential growth is very unintuitive. And once we understand that containment is our only option, the beauty of it is that you can actually cut the chain of transmission. It stops that quickly as well. So it doesn't have to be an endless months-long strategy. It's a 7-week solution, 5-7 weeks. But you have to be very serious about it during those 5-7 weeks.
You have worked with the European Union countries also in the lockdown, but we still see many of them have not gone into a full lockdown. Where did you think they committed mistakes, and whether India is repeating those mistakes or we are learning from those mistakes and not repeating them?
That's a very good question, Pramod. So here's the thing, a lot of countries have not taken this very seriously, and they've done what they call a partial lockdown. So they have stopped the large concerts, the large parties, big events, but they still haven't restricted people from having mobility within the country. I'm currently in the Netherlands. Okay, it's a really, really small country. But despite that, the number of cases here is huge. A lot of European countries are also misled by the idea that their healthcare is better. So they could perhaps be more relaxed about these rules. There is no way they can handle this. Mark my words, because here's the thing, there is an avalanche coming towards these countries, and there is no way you can handle it with a little bit of preparation.
Where was the miscalculation?
It's not recognizing that exponential growth will outpace human preparation, right? If you prepare for X today, and whatever's coming at you is at X, that's fine. You think you can be 2X, but this X is going to be 10X in 10 days. Right? What are you going to do then? Maybe you can grow. Maybe you think you have the money. That 10x is going to be 100x in another 10 days. So this is something people, it's very hard for humans to understand how quickly exponential growth can outscale you. And from that perspective, the Indian response, top down, is solid. Okay. India understands. India was one of the first countries, in fact, probably the first major country to cancel all visas.
Probably because we are damn sure our healthcare system wouldn't be able to handle this.
Yeah. I think it takes a level of prudence and thinking.
Yeah. राज तू कशें दिसता इंडियेक जर तो रिस्पॉन्स जर पळयलो जाल्यार वॉट आर युअर फर्स्ट थॉट्स की आमी हँडल केला सारकें एक ओके टॉप टू बॉटम अप्रोच जंय वेल्यान सिरियसनेस आसा बट तो सिरियसनेस खरेंच एट द बॉटम पावला काय कितें आनी तूं जेन्ना आज घराची भायर पळयता परिस्थिती what do you think?
So I firstly think that, as Sriram was saying, India did a very good thing by moving early, right? Even before people saw it as a threat, the government recognized that this can be a problem. They learned from mistakes of other countries and they imposed the lockdown. But amchi country, there are more than 1 billion people in our country, right? And the seriousness of the message to come to the grassroots level, especially janna ki lok marna tanchasadin, there are no deaths happening around, right? Like it becomes, people start questioning ki do we really need this? Why are we stopping everything?
Like, alarming situation asa kai kite.
Hi, so ani what's the joke asa situation and ki आता जे कितें आमी करता, right, it looks like alarmist, it looks like it is not required, right? But if we don't do this, then we will be in a situation wherein our hands will be tied. Whatever we do will not be a response that is enough, because the virus would have already spread all around. So rest of India at this point of time is, I think the metros are having a tough time, because people who we are in touch with, especially startups which are running like ambulance management systems, they know that on ground their infrastructure is completely jammed. At any outbreak, there are things known as a leading indicator and a lagging indicator. Number of deaths ji asa, that is a lagging indicator. So outbreak जातकीर तुका 3-4 weekani you realize what has happened, right? When you're counting deaths. But if you look at the number of ambulance calls, the number of 108 calls that you're getting, for example, that will tell you ki what storm, vadal kashe hopacha aसा te.
How it is brewing.
How it is brewing, right? This data is not really out in the public domain. The earthquake amka laguna azun parent, right? And thankfully Goa, I would say right now, whatever the numbers are coming out, I'm always on my toes, right? Like I'm always skeptical, but it is looking good so far. And I would say that we should maintain our, clear score sheet.
Yeah, track record.
We should be putting in even more effort to keep it that way, right? Easy ke upachana.
Yeah, easy ke upachana. Sriram, one major point I think everybody wants to know is this social distancing, follow the norms, use face masks and all these kind of things. For how long is this going to continue? Because one thing is that it's just like another flu, and the flu seasons keep on coming and going. So if you look at the situation, or if you look at least the genesis of the problem and the virus, so is this a part of our life now? The social distancing, the face mask, we find it very odd when we move out on the streets and you see a known person wearing a mask, and sometimes you fail to recognize that person because he is wearing a mask. And then the thought comes to your mind whether this is the new normal. So do you think this is the new normal?
That's a big question, but actually I do think it's the new normal for a bit, at least. Yeah, this is a pandemic is a time when every other country is facing the same problem as you. Okay, so it's not something that's going to be gradually spreading through the world, which means you don't know where the sources of infection lie. Even if Goa is clean now, Goa is green. Okay, no cases, no new cases. Goa is safe. Goa will still have to have interactions with the rest of the country, the rest of the world. There is no way you want to cut entirely out, right? And when you do that, we need to have real protocols in place so that we are able to protect the people here. But again, because it is so non-linear, the fact that one case can quickly lead to a real serious outbreak, we will need to protect ourselves to the extent we can. And in some sense, it goes back to some of the ancient practices that a lot of people had, where people would actively distance each other from each other, and a lot of superstition around it. But in some sense, it's got a modern twist. Face masks also protect you from, I don't know, AI. They protect you from closed circuit cameras tracking you. So in some sense, it makes you more independent.
Yeah.
So you can see a very global movement towards people adopting this very, very quickly.
This virus is taking us back to our roots in a really frightening way.
Yeah. I mean, I can no longer travel, like 10 kilometers, right?
Yeah.
Which is what I think my grandparents also couldn't travel more than 10 kilometers in a day. So
yeah, but that wasn't so frightening.
Yes, it wasn't frightening, right?
It was exciting probably back then.
But we need to recognize that right now we are at war in a way, right? Just that it is the enemy is not people. It's not some people who we can hate, right? It is a common enemy that the world has, and it is around, like everywhere. No one saw this coming. This is like science fiction.
Yeah.
It's like in the movies.
I was trying to watch a series on Amazon Prime. I started watching the first episode and realized that my life is more interesting than what they are showing there. So I just switched it off and I started living my life the way it has become right now. But Sriram, one thing is that the question is lockdown. Okay, it sounds nice that you are participating in a nationwide exercise. You are trying to stay home, save lives. Very catchy phrases, but when the lockdown ends, and it has to end probably with certain risks, because you cannot be at a standstill forever. What happens on that 14th April or that 15th April? How do you move from a lockdown scenario or a lockdown state of body and state of mind to a non-lockdown state of body and state of mind? So what is the transition that is required?
So, first of all, I'll address the elephant in the room, which is the lockdown opening up on the 14th? And our formal recommendation is that
That's
it has to be
elephant in the country.
Exactly. Everyone's asking the same question, right?
Yeah.
So this can't be an immediate process. It can't be lockdown today, open up tomorrow. That's very risky strategy. What we really need to do here is understand what's essential, what services, what businesses, what logistics, which of these are essential for the economy, and gradually open them up. But open them up in a manner that you already have protocols in place, that even if infection slips in to your territory, you have a way to check it. Okay. So one thing could be, let's say the port is not fully functional and the port becomes a little more functional. Okay. And if that's the case, then ensure that everyone who is taking cargo from there and driving into the state is tested at the port of entry, port of exit, right? Put basic protocols in place and then see if you can open up those aspects of the economy, right? And then we gradually keep doing that. Over time, you will recognize that you can do 90%, 80% of what we're doing despite a lockdown. But what it really means is you have limited all the riskiest activities you've been doing.
So the question is, I'll give you a classic example of my own state, because that's the best example probably you can extrapolate in present times. We are a small state. Our dependency level on the neighboring states is very high, from milk to vegetables to groceries. So when things open up tomorrow, although the essential supplies are on, when you open things up, there is going to be a lot more movement. And unfortunately, our neighboring states seem to be two of the states which are most affected. So how do we separate now? How do we do that demarcation from maybe affected districts to non-affected districts, no traffic from the affected districts to traffic from the non-affected districts? Can a system like that be even worked out?
Yeah, here's the thing, Pramod. You have to ensure that your territory is safe.
Yeah.
And it has
So
to be very, very local
how to
response.
mitigate that?
So
You have
I
to
think,
zone.
Yeah, Raj.
Yeah, so I think the advantage that we have is that our districts are almost like our states,
Yeah.
right? Which is not the luxury that other states have. Their district boundaries are still very porous. For us, I think the best thing to happen is that Goa's boundaries are locked down, right? And the locking down of Goa's boundary, it might hit industries such as tourism, right? But I think tourism would have anyways been hit because under this fear of the virus, and with the global recession coming in,
your flights are not working.
Flights are not working, and the people are scared. Travel
Who wants to go on a holiday?
Holiday, right?
Yeah.
So tourism is going to take a hit. We should recognize that, irrespective of boundaries being open or not, and hence we should do the best. What is the best for our state, and keep the boundaries shut.
Yeah.
For as long as Maharashtra and Karnataka at least do not control the outbreak. And we should use the time that we have.
So Raj, the
right?
question is, your essential commodities come from there. Once you open it, although we are getting the essential commodities today, things are much more controlled, monitored. Once you open things up, that monitoring level, that level of alertness will definitely go down. How do you mitigate that? Can you separate the affected districts from the non-affected districts? Open supply lines from the non-affected areas, but not from the affected areas? Is even a system like that, phase-wise opening of that lockdown, what we call it, possible practically?
I think practically it is all about the implementation on the ground. The checkposts or whatever. I think rapid testing needs to be done at the checkposts, right? That is one scenario. But remember, in the worst case, in Belgaum, there are already cases which have shown up. Yes. So in the worst case, even they might not even be able to provide us with essentials,
because they have shut themselves down.
Yes, they themselves down may not be able to supply us with essentials. We need to be prepared for that case. Remember that it has gone from living life and campaigning for Zilla Panchayat elections to where we are right now in under a month. We don't know how bad it can get if our neighbors do not do their job well. So I think we need to be prepared for the extreme worst case scenario, right? And that could be the driver of Goa being able to provide employment for its own people. We need to, rather than increasing our reliance on our neighboring states, try and see how we can provide for ourselves.
We should start increasing the self-reliance.
Yes, self-reliance, and remember that this is a wartime economy, right? We have a population which is very good at speaking English, whereas services if we manage to stay in the green, services and worst case Bombay, Pune, Bangalore, they are heavily affected already, right? We can be providing for the rest of country, be it IT services, be it BPO, call center type of services, because we know English, right? That is our greatest strength. We can be exporting for once services to the rest of the country, right? And that should be, I think, our the aggression with which we should be tackling this issue economically.
Good points, Raj. That's Sriram, but the point he said that exporting services. Now we have come to that. But even when this lockdown opens up, rest of the world is not going to open up with you. They will have their different schedules of lockdowns. They will have their different schedules. They will have different schedules of their problems and solutions. How do you look at it? Suppose India opens up its airports, but Europe and United States are not opening up their airports. So what kind of a scenario we are looking at probably 1 month down the line?
International travel by plane, cruise ships. I think this industry is sort of dead for a while. You can rest assured. We are talking about a scenario where
that a while.
6 to 12 months at minimum. Depends on how. Here's the thing, right? Whatever we're talking about, different states, different districts being green in terms of how many cases they have. If they have no cases, they're green. If they have even a single case, they're probably yellow. And if they have a lot of cases, they're red. If we start looking at the world in terms of zones, we will have to start defining the world in terms of green, red, yellow zones. And currently, majority of the countries in the world are a red zone. India is one of the countries that's probably yellow zone. India is not a red zone. A lot of 60% of India's districts are probably free at this point. The thing is, very few countries, like China is probably a bit of a green zone right now. Okay. But
The
most
irony
countries,
of it.
exactly the irony of it, right? So imagine making a trip to Europe. There is no way someone would want to take that risk. None of these countries would want to accept you. And India will not take you back. I can't fly back to India today if I wanted to. And that's a very smart move. India shouldn't be taking back people like me, should be protecting people who are currently in India. Right? So these industries are sort of disruptive. Yeah.
But tell me, one important factor then is what happens to the economy. Now, I think we cannot even call it recession. It has gone beyond that. This kind of, it has completely gone beyond that. We'll have to probably coin a new word to describe the economic state that we are into. So when you look at the economy of India and economy of the world, is there anything that can soften this blow, lessen the pain, or it's just that let's get the outbreak in control first and then sir salamat to pagdi pachas kind of a thing?
I think you're right. Like the only way we can get out of this is by breaking down the world in these zones and containing the virus, like being aggressive about containing the virus in each and every of the zone. Because even if one zone remains, right, we are going to not get a good sleep. We will be always thinking, what if it breaks out tomorrow, right? I think the only way we can get out of it, and I think Sriram would agree, is by containing the
And that's also because we are saying that even if we come out with a vaccine, it's going to, the timeline is minimum 1 year.
It's going to take time, and given how large a country India is, how complex it is, distributing just within India. Now I'm assuming that India can manufacture the vaccine. Okay. Even distributing within the country is going to take some time. So we should think of it as eliminating polio. It's closer to that than trying to get rid of the flu, right? A lot of people confuse. They are like, this is a more severe flu. No, it's not a more severe flu. It's like polio, because we do see that people have long-term effects after they're cured as well, right? So this is not something you can just assume that a lot of people are going to get it and then people are going to be fine off after that as long as they don't die. You're going to have severe long-term effects in the population as well. So we better think of it as, okay, this is a serious thing. Let's get rid of it and then let's get back to work. The good thing is if, we as India are able to protect people, we can very quickly become the manufacturing and services hub for the world, right? A lot of the world is going to need this, not just the West. It's also going to be Africa. We can basically expect every country to go through its own epidemic cycle, all right? And a lot of these countries, hopefully, a lot of these countries will be smart about it and they'll be very quick with how they stop it. But a lot of these countries may not be, which means the cycle will stretch. And for that period of time, you will need countries that are relatively safe to provide for the rest of the world. And I think that's a huge responsibility that India must.
What you are effectively saying is it's not global recession, but it's global economic disintegration.
Disintegration. It's a war. It's a world war, except that we are at war with the virus.
But you are disintegrating the economy so that we can complement each other.
It back. Yeah. So, Pramod, just a simple example. When there's a sharp turn on the road, the slower you go in the turn, the faster you can come out of it. This is a situation like that. We need to brake hard right now, freeze everything so that we can actually bounce back faster. The more sushagad we are with like dealing with this, the more we will be like in pain as we go ahead. Right?
So you are saying that economic disintegration is the need of the hour.
Physical decoupling. I want to add something here. What's really important is physical decoupling. Okay. A lot of the economy is digital today.
You're just making it sound nicer now.
No, because you have to recognize one thing. Here's the thing, right? So Pramod, you have to recognize that in the last 50 years, a lot of our GDP, world's GDP, has been decoupled from physical world, right? Because earlier it used to be mining, agriculture, which was 80-90% of the GDP for every country. Right now it's a small percentage. Right? And goods are also pretty small percentage. Services are becoming increasingly higher, and a lot of these services are digital. So if you really look at the world economy, a good chunk of it will still function because it's going to be digital. Problem is people are not going to consume as much. Okay.
Correct.
If you're scared, you're not going to go ahead and buy or shop, or that's where the real problem is. And I guess this will be a challenge that every government will have to figure out. How do you how do you stimulate an economy to start consuming again?
Yeah. In spite of
as you said,
atmosphere of fear around you.
As you said, Pramod, there is no user manual. We should be the ones to write it. Right?
Yeah.
We should be the ones to
But
set
Raj,
an example.
Because of three primary factors I'm saying. One, in terms of primary sector, we are hugely dependent upon other states. Our mining was our strength, but our mining is right now not continuing. So another major arm of our primary sector is at standstill. Probably if mining had continued, we would have had much more capital in our bank accounts and in our economy to use it at this particular point of time. Our secondary sector, again, service sector, our tourism industry, again, is going to take a very, very big blow. The tertiary service sector, if these two sectors collapse, there's no way your tertiary sector is going to sustain itself. So, गोंयाकडेन पळयतना, is there a ray of hope, or तू म्हणटा तशें rather than crash landing, break landing?
Yeah, I think this is the situation in which we are. I mean, we have the cards that we have. Now the question is, what do we do with it? Right? I believe that, I mean, I feel we need to believe in ourselves. That even though we are in the sort of situation we are, that we can get out of it provided we contain the outbreak. Step one, we contain the outbreak. We are already 10 times better than the rest of the world at this point of time.
Let's maintain that pace.
Outbreak. Yes, if we are virus free, that is like wow, right?
That's like a real sweet ending Hollywood movie.
Yeah, you have wealth that no other country has. Like health is wealth, we have that which no other place will have.
Yeah.
And once we are there, economy at the end of the day is relative. So we can capture the market share of other year. Like this is the real time to shine. Yeah. I want to look at it that way because look at it in a positive light. Because otherwise, like we are done for.
Yeah. Yes. How to convert this adversity into an opportunity. I think all our energies need to go into that.
Never let a good crisis go waste.
Yeah, never let a good crisis go waste. And I think you cannot have better crisis than this. Sorry for the choice of words. So, Sriram, final words. I'm completely out of time, but quickly in 15 seconds, one message you can give to the world right now.
Take COVID-19 very seriously.
Yeah.
India is doing the right thing by locking down. Stay safe, stay healthy. The choice between your health and the economy is not a real choice. If India isn't healthy, then there is no economy to speak of. So let's focus on getting rid of the virus first. We can gradually open up the economy when it comes to that.
We come back to the same thing. Sir Salamat to Pagdi 50. Raj, you are in Goa?
Yes, I am in Panjim, yes.
So you are in Panjim. So ironically, you are in one of the safest zones and Sriram is one of the toughest zones. So I think that explains how the world is functioning right now. Sriram, stay safe. When the things open up, I think let's meet over a nice cup of coffee or drinks or dinner, whatever you prefer. But till then, I think let's focus upon just containing this and defeating this enemy. Thanks a lot for talking to us. You are in a different part of the world. Still, you took time out and spoke to us. Raj, thanks for arranging this. I think people of Goa need to hear this. And I think lot takeaways out of this. So Raj, Sriram, thanks a lot. If required, I think in the coming weeks, we'll come back to you so that we can all share our experiences and expertise so it benefits everybody. Thank you.
Absolutely. Thanks, Pramod. Thanks, Raj.
Thanks,